Hashimoto's disease has very few treatments available for patients, despite being the most frequent cause of hypothyroidism in developed countries. This is because most doctors consider Hashimoto's disease to be an autoimmune condition with a simple cure: prescription thyroid medication. But there's a catch. Although thyroid medication can improve your mood by boosting thyroid function, it usually has no effect on the thyroid gland destruction caused by the autoimmune component of Hashimoto's disease. In addition, very few people who take it report feeling better. For these reasons, it should not be surprising that patients with Hashimoto's disease are searching for and demanding new treatments. And today, if that describes you, I have some good news. We're going to look into some of these more recent therapeutic alternatives. First, as you are undoubtedly aware, levothyroxine is the gold standard for treating Hashimoto's disease. Let's discuss various levothyroxine alternatives. Just 19% of patients taking this drug say they prefer it over other options, despite the fact that it contains bioidentical T4 thyroid hormone, which is meant to replace lost thyroid hormone caused by thyroid gland damage. Unfortunately, most individuals dislike it. Thankfully, there are a lot of additional options available these days, such as improved T4 alone options and novel NDT drugs. Let's discuss some of the more recent T4-only drugs that are currently available. These drugs all contain the same thyroid hormone, T4, but they vary in terms of how they are administered and what inert chemicals they contain. These minor adjustments are adequate to enhance the degree to which the drug will alleviate your symptoms. Out of all the thyroid medications currently on the market, 2 of these are from the Thyroid medication line: Tirosint, which comes in a gel cap form, and Tirosint Sol, which comes in a liquid form. Because they contain the fewest inactive ingredients, these options are less likely to cause reactions and are therefore cleaner. The main drawback to these Tirosint options is their cost, but there are generics specifically for Tirosint that are not yet available. This means that you will feel better when you take them as opposed to something like levothyroxine. Research has shown that Tirosint, unlike levothyroxine, can even be taken at the same time as a meal without impacting its absorption. Despite this, only about 50 to 60% of patients who switch to Tirosint actually see improvement at this time. In addition, levothyroxine injections, which only need to be administered once a week, are available. These injections, which bypass the gastrointestinal tract, which is frequently a location of malabsorption, entered Phase 2 clinical trials in 2023. They are still undergoing dosage studies, but in the upcoming years, they might become a viable option. Let's go on to discuss the newly accessible forms of non-destructive testing. The novel drug I'm discussing here is known as ADT-HYZA. Since Nature Thyroid and VUP Thyroid are still unavailable, ADT-HYZA, like other NDT formulations, contains a combination of T4 and T3 thyroid hormones. It also claims to be lactose-free, corn-free, dye-free, and latex-free, giving you an additional option in addition to NP thyroid and Armour thyroid. Research has shown that thyroid patients consistently prefer NDT formulations over T4-only thyroid medications like levothyroxine. And finally, we have replacement of thyroid hormone in combination. The goal is to give the body a variety of thyroid hormone types, so that it more closely resembles the thyroid hormone produced by a healthy thyroid gland. Combining T2, T3, and T4 together can more closely mimic the thyroid hormone production from a healthy thyroid gland, which is why this tactic has gained popularity as T2 thyroid hormone has gained notoriety as an active thyroid hormone. T2 has also been shown to support metabolic function, fat oxidation, and enhance He3 binding on the thyroid nuclear receptor. Some studies have also suggested that it may aid in weight loss. This tactic does call for the usage of T2 supplements and the acquisition of various prescription drugs. So what does this really mean for Hashimoto's? Let's find out. But first, if you made it this far into the video, Thank you. These videos take a lot of effort and time to make, so if you enjoyed them, please hit the like button, subscribe to the channel. This goes a long way in helping us grow. That's said, back to the video. However, individuals who follow this course of action report feeling significantly better than those who simply take T4 alone. Patients with Hashimoto's disease may also consider off-label prescription medications as a treatment option. These medications typically target the immune system, and by doing so, the theory is that they may help prevent thyroid gland destruction, which may mean they may have some benefit in reversing the disease. Although their use is considered off-label because they are not officially approved for the treatment of Hashimoto's disease, there are still some studies and anecdotal evidence to suggest that they are effective. Metformin is the first drug on this list. Although metformin is commonly prescribed off-label to address ailments including weight reduction and longevity, it is also frequently used to treat diabetes and insulin resistance. We can definitely add Hashimoto to that list as well. It's important to note that these studies are small, making it difficult to draw firm conclusions. But given that metformin is so inexpensive and that the hypothyroid state frequently exacerbates insulin resistance, it's definitely worth a try for the majority of Hashimoto's patients. Over the last 5 years, 17 studies have demonstrated that metformin has a positive impact on TSH as well as thyroid antibodies. Studies conducted in mice have also demonstrated the exact same thing. Low-dose naltrexone is the second medication on this list. Although it was initially developed to treat alcohol dependence, it is frequently used off-label, in much smaller doses, to treat autoimmune diseases such as Hashimoto's disease. When used in this manner, the medication is referred to as low-dose naltrexone. It's currently believed that taking low doses of naltrexone has an immunomodulatory effect on the immune system, which helps reduce thyroid antibodies and inflammation in the gland. Unfortunately, there are no large-scale studies demonstrating that can be effective for this condition. But there are plenty of anecdotes from both providers and patients saying that it does work. Naltrexone is traditionally dosed up to 50 milligrams per day. On the other hand, if you're using it to treat Hashimoto's disease, your daily dose will likely range from 1.5 to 4.5 milligrams. Based on my personal experience and the experiences of others, I would estimate that taking this medication offers you roughly a 50% chance of seeing some improvement in your thyroid lab tests and in your symptoms. Since low-dosage naltrexone has few adverse effects and is generally well tolerated, it's worth a try for most Hashimoto's patients, especially if other therapies haven't worked for them. Of those, 25% will improve greatly, and approximately 25% will benefit somewhat. Steroids are the next drug on this list. There really isn't a place for steroids like prednisolone in the setting of Hashimoto's except for two exceptions. The first is that they may be beneficial in an acute flare-up. The second is in the presence of a condition called Hashimoto's encephalopathy, and the fact that they've actually been shown to reduce thyroid function. Steroids like prednisolone are some of the most potent anti-inflammatory agents that exist in terms of medications, and they are frequently used to treat other autoimmune diseases like lupus or rheumatoid arthritis. Since Hashimoto's is primarily localized to the thyroid gland inside of your neck, it doesn't always make sense to suppress the immune system of the entire body in order to affect that one gland. If you do this, you could get very serious infections. The next set of medications on this list includes immunomodulators and immunosuppressants. These are occasionally floated as potential treatment options for patients with Hashimoto, but they have the same problem as steroids, which is a huge list of side effects. Most doctors, including myself, now believe that the hazards exceed the advantages. And as of right now, there isn't much evidence to support their potential benefits. Therefore, I would advise against using them in addition to thyroid hormones and off-level drugs. Surgery is another option. They consist of a thyroidectomy, which is the total removal of the thyroid gland, or a partial thyroidectomy, which is the removal of portion of the thyroid gland. If you have Hashimoto's disease and your antibody level is higher than 1,000. Some doctors are investigating the possibility that it could be preferable to remove your thyroid gland. Studies have shown that people in this situation do see a reduction in symptoms following thyroid gland removal. Thankfully, this treatment is only being offered to patients who have exhausted all other options and are still unable to find relief. However, in my opinion, thyroid gland removals should never be performed unless they are absolutely necessary. While they may seem like a good idea at the time, many people regret having their thyroid removed, especially if they felt pressured into the procedure. Thyroid hormone replacement is never as effective as the real thing, and patients without thyroids frequently experience difficulties with weight gain issues related to sexual dysfunction and body image. Next, the group of treatments that I think are the best are probably natural ones. If you have Hashimoto's disease, don't make the mistake of thinking that you have to take medication to treat your condition. In my opinion, natural treatments are some of the best options for patients with Hashimoto's disease, and most of the time, people just pass them by. Not only are they safe and effective, but they can also work, and believe it or not, there is some research supporting their use. The first natural treatment I want to discuss here is red light therapy. Numerous studies have demonstrated the efficacy of red light therapy, also known as low-level laser therapy, in treating Hashimoto's disease patients, because your thyroid gland is so superficial, that is, so close to the skin. Light with a wavelength of 600 to 1300 nm can penetrate up to 2 inches into the skin. This is enough to bathe your thyroid in red light, which activates the mitochondria there and aids in the production of anti-inflammatory cytokines by your body. In a study including more than 70 women, it was found that red light therapy along with a few certain supplements was sufficient to lower TSH, thyroid antibodies, and BMI. The wavelength of the red light employed in the study was 830 nm. The next natural remedy I'd like to discuss is food intake can have a significant impact on your health and can be used to cure or reverse illnesses like Hashimoto's, and proper food and lighting regimen could greatly improve thyroid gland function and lower the reactivity of autoantibodies in the thyroid, according to one study that cited data from scientific and clinical investigations. Put another way, eating the right foods, or in the case of the study I just mentioned, combining them with red light, can significantly improve your thyroid. Dietary recommendations can quickly become complex, but the simplest way to think about it is whether a food causes inflammation or lessens it. In order to lower inflammation, consume a diet high in protein, fiber, and omega-3 fatty acids. If you want your diet to exacerbate Hashimoto's symptoms and create inflammation, consume a lot of processed foods with artificial coloring and flavorings, as well as refined carbs. Other food groups that have been linked to problems for Hashimoto's disease patients include gluten, dairy, and soy. One of the most effective ways to treat your condition is through diet, and some patients have even said that making dietary changes was sufficient to put their illness into remission. Supplements are the next natural remedy you should be aware of. Vitamins. Numerous studies have demonstrated the effectiveness of minerals and botanicals in the treatment of Hashimoto's. Here are a few of the most well-researched and validated ones. Nigella sativa. When ingesting 2 grams of Nigella sativa daily, nearly 40 patients with this condition showed improvement in a double-blind placebo-controlled experiment. Researchers discovered that patients who received this medication experienced decreases in VAFF, thyroid antibodies, and TSH. The second is selenium. These new treatments hold a lot of promise for patients with this condition, as many of them are far superior to the alternative of taking levothyroxine and waiting it out. A meta-analysis of over 6 different studies found that taking selenium can reduce thyroid antibodies after 3 and 6 months. One study of over 80 patients with Hashimoto's disease found that combining inositol with selenium was enough to reduce TSH and thyroid antibodies. You don't really need additional Hashimoto's treatments despite the fact that I know many of you out there are desperate for more ones. There are plenty of natural and conventional treatments available to you right now that will be sufficient to improve your condition and possibly put it into remission. The key here is awareness, as the majority of medical professionals and patients alike are unaware that levothyroxine is not the only medication available. The best place to start if you're interested in controlling your Hashimoto's disease is with your food. As we wrap up our deep dive into the latest treatments for Hashimoto's disease, it's important to remember that managing this condition is a highly individual journey. The advancements in medical research are providing new hope and possibilities for those living with Hashimoto's. From innovative medication options and personalized diet plans to groundbreaking therapies and holistic approaches, the future looks promising. However, always consult with your healthcare provider to tailor these treatments to your specific needs and ensure the best possible outcome. At Health Angel Solutions, our mission is to empower you with the knowledge and tools to take control of your health. By staying informed about the latest developments in Hashimoto's treatment, you can make educated decisions and advocate for your well-being. Whether you're newly diagnosed or have been managing Hashimoto's for years, we're here to support you every step of the way. If you thought this video was helpful, kindly give it a thumbs up. Your likes help us understand what content resonates with you and encourages us to continue providing valuable information. Don't forget to share this video with anyone who might benefit from learning about new treatments for Hashimoto's. By sharing, you're helping to spread awareness and support within the community. Lastly, make sure to subscribe to our channel, Health Angel Solutions, and hit the notification bell so you never miss an update. We regularly post videos on various health topics, providing you with the latest insights, tips, and research. Your subscription not only supports our channel, but also ensures you stay connected with the latest health information. We appreciate your time and hope to see you in our upcoming video.